And it's cold.
Scanning room. 210 remediation. Okay, knock, knock, knock. Hello, my name's Gracie. I'm going to be your student nurse today. I'm going to go ahead and provide privacy and wash my hands. Can you go ahead and show me your wristband and confirm your name and date of birth?
Raymond Montgomery, 01-2005.
Okay, perfect. I'm going to be doing your head-to-toe assessment today, but first I'm going to be asking you some questions, so just answer to the best of your ability. Do you have any family medical history you know about, like heart disease, diabetes, hypertension?
I do not.
And have you ever had surgery before?
Nope.
And do you have any allergies?
Nope.
And do you have any medical history I should know about?
I do not.
Okay. And what has brought you here today?
Hit my head at work.
You hit your head at work?
Yes, ma'am.
And can you tell me a little bit more about that?
I hit my head at work. I hit my head on scaffolding from the bricklayers.
Okay. And where did you hit your head?
My forehead.
And when did this happen?
This morning.
This morning. Can you point to where it's hurting? And how long is it hurting, like the duration?
The duration's probably every 15.
Every 15 minutes?
Right.
Okay. And can you tell me a little bit about the pain it's giving you?
It's like a throbbing pain.
Throbbing pain. And have you done anything to help it? Taking medicine?
I've kind of just winged it until now.
Okay. And does anything make it worse or better?
I mean, light doesn't help too much.
Light?
Yeah.
Okay. All right. Well, I'm going to be doing your head to toe, and I am going to be doing your vitals first.
Okay.
So I'm going to go ahead and take your temperature. Okay, 98. And then I am going to take your oxygen. Okay, also 98. I'm gonna get my timer. Okay, I'm gonna get my timer. Okay, and then I'm going to take your pulse. So if I can have your arm, uncross your legs for me. And you can just rest.
Thank
Okay, perfect. 62 beats per minute. Okay, now I'm going to do that one more time. If you'll just sit normally.
Sorry, I had an itch.
Okay, 18 is your respiration. I'm gonna go ahead and take your blood pressure. And cross your legs for me. Okay, set this right there. You can extend your arm. Okay, you can rest. 120 over 40. And are you in a comfortable position right now?
I suppose.
Okay. So now I'm gonna start the head to toe assessment.
Okay.
I'm just gonna ask you a various of questions if you'll just answer to the best of your ability.
Okay.
Can you tell me where you are right now?
I'm at the Christ Hospital.
And do you know what day it is?
It is Monday, December 8th.
And do you know why you're here today?
Oh yeah, I got hit in the head. I'm sorry.
And then do you know who the President of the United States is?
Donald Trump.
Okay. So I'm just gonna touch your hair and
Okay,
inspect
that's
it
fine.
if that's okay.
That's fine.
Okay. I don't see any infestations or feel any masses or lesions. Can you smile for me and frown and then puff out your cheeks and raise your eyebrows? Okay. Now I am going to have you just look straight ahead and I'm going to look at your eyes.
Yes, ma'am.
So I'm just gonna look and see if it accommodates to my left. Okay, it accommodates to my light. And I'll just follow. Can you look straight ahead?
Sorry.
Okay, pupil size is 4 millimeters. And the sclera and conjunctiva look normal, nice blue eyes. Now I am going to inspect your nose, so we'll just look up a little bit. And now if you'll open your mouth. Okay, lift up your tongue. Okay. Mucus, or the membranes are nice and pink, no scars or anything noted. I am now going to look in your ears. Okay, nothing in the auditory canal that I can see. Does that hurt when I touch it?
It does not.
Look at the other one. Does that hurt when I touch it?
No, not really.
Okay. Now I am going to have you look straight ahead and follow my pen light. We're going to do the cardinal gaze.
Okay.
Okay, perfect. And now I am going to have you look straight ahead. I am going to put my fingers and you're going to open your jaw. Did you feel any pain when you were doing that?
I did not.
Okay, and now I'm going to have you look that way. Can you sit up a little bit more? Okay, and look the other way. Okay, you know, JVD is noted. And now I am going to have you sit up and look that way, the other way, and up and down. And now I'm going to put my hand and have you resist against it.
Yes.
Okay, good. The other. Okay. Okay. Perfect. And now I'm going to have you take a drink of water. And just let me know if you have any
course.
pain. Did you have any pain?
Nope.
Okay. So now that we did that, have you had any recent hearing loss?
No, I have not.
And what about any migraines or bad headaches?
Other than today, no.
Okay. Okay, now I'm going to have you sit up a little bit. I am going to assess the posterior respiratory and anterior. And it is 10 on the back and 8 on the front. So every time I move, just please breathe in.
Right.
Okay. Now I'm gonna do the anterior, so if you'll just sit up. Okay, everything sounds clear. Now I'm gonna do your heart. So I'm gonna start with the apical. Okay, on the pulmonale. Now the Erb's point. Tricuspid. Now mitral. Now I'm gonna listen again with the bell. Okay. No sounds were heard. Now going back to the respiratory, you had any coughs recently?
Yeah.
You
A little
have?
bit. Yeah.
And can you explain to me when that has happened or when that started?
Normally after I drink something.
After you drink something.
Right.
Okay. And do you have any trouble like breathing when you're laying down?
I do not.
Okay. And then do you get shortness of breath easily?
Yeah.
You do.
I do.
Okay. And then do you get fatigued easily like when you're going to the bathroom?
No.
Okay. Okay. So now I am going to go ahead and move on with the upper extremities.
Okay.
So if you'll just have your arms to the
Yeah,
side.
of course.
And now I'm going to assess your temperature down all the way down your arms bilaterally. Now when I'm touching it, it's dry and warm and the skin is intact bilaterally going all the way down. So now I'm going to do edema bilaterally and see if Mr. Montgomery has any edema going down his arms. And now I'm going to do skin turgor. And there's no skin turgor, so you're pretty hydrated. Now I'm going to do your capillary refill, so if I can see your fingers. Okay, and they refilled less than 2 seconds. So now I am going to have you squeeze my wrist. I'm going to test the strength of your grips. Okay, perfect. Now I am going to have you shrug your shoulders. Okay, and can you lift your arms up? Okay, perfect. Now I'm going to put resistance. So can you put your arms up again? Resist against my arms. Okay. Now do it low. Okay. Now going back to your arms, I'm going to compare your pulses bilaterally. So if you'll start with the brachial, radial, the radial pulses. And they're all normal 3+. So now I am going to have you Are you still in a comfortable position?
Yeah, I'm fairly comfortable.
Okay, so now that I remediated the neuro, heart, respiratory, and upper extremities, I don't have to do the rest. I'm going to thank the patient when I'm done. Going back to the upper extremities, did you have any pain when you were moving your arms?
I did not know.
Okay, perfect. So I'll make sure to wash my hands again, thank the patient for letting me care for him, and then I will tell him his plan of care, and then I would leave giving him privacy again.